Good evening, and this is for you, Kathy Jenkins, because you asked me to. My speech. I'm going to read it. It's 15 minutes. Hello, and good morning, everyone. And can I begin by saying what a huge pleasure and honour it is to be here as the first speaker at this inaugural Family Day. My name is Helen Pitt, and I was 62 when I was diagnosed with triple-negative breast cancer. I won't ever forget the consultant who delivered the news to me. He looked down at where I was seated on the examination table and said, "You have a long road ahead of you, my dear." He wasn't wrong. The diagnosis did not surprise me a bit, since my mother had breast cancer when she was in her mid-60s, and my maternal grandmother also had breast cancer in her mid-60s. I have blogged about their cancer in relation to how it has affected me, and I'd like to take this opportunity to read a small piece from one of my blogs now to give you a little background. My mother's breast cancer, which was hormonally triggered, appeared in my mother's 65th year. She had 3 quite large tumours in her left breast. I felt them. They felt like pieces of grit trapped beneath her skin. She had a mastectomy just a few days after her diagnosis, and the surgeons also removed the lymph nodes on her left side. She continued to live a full and happy life, undeterred by a further 5 years of tamoxifen treatment, and she died peacefully in her sleep when she was 82. My mother taught me how not to be scared. My maternal grandmother was not so fortunate. There were no effective treatments for breast cancer when she was diagnosed in the early 1950s, and even if there had have been, she was a stoic and would have chosen to put up and shut up. Had she sought treatment, then she might have been told to try radiation therapy, I suppose, or pray. She died in October 1953, 3 weeks before I was born, and my mother commented to me once how great the discomfort my grandmother must have been in. Her cancer had spread, amongst other places, along her upper left arm, which was massively ulcerated before she died. However, she didn't complain. Those were surely the dark days of a breast cancer diagnosis. When I began having mammograms in my 50s, I was told many times that I was at no more significant risk than any other woman in the population, but I never really believed it. I almost expected to be told I had breast cancer. You may find this odd, or a kind of be careful what you wish for philosophy, but I never wished for cancer to invade my breast, and actually I feel that preparing myself for the possibility, psychologically, was ultimately helpful for me. So when I was given my diagnosis, the news wasn't as difficult to manage as I know it can be for many, many other women and occasionally men. My treatment began 4 weeks after my diagnosis. It seemed a lifetime, as I wanted to crack on and get on with it and feel more in control of my life. I was diagnosed at stage 2. I had 2 tumours in my left breast, and I had neoadjuvant chemotherapy treatment, which went on for 5 months. It was called Phecti. I'm sure you're all familiar with it. The ingredients of Phecti sound to me like a weed killer, and they probably are. And they have been given suitable nicknames by those who have endured them, such as the Red Devil and the Batterer. In spite of this, the chemotherapy unit can be quite a jolly place, and I made some new friends there. When my chemotherapy was finished, I had surgery, that would be around July, to remove what was left of the tumours. They had shrunk quite a lot and become very soft, and were later found to have no live cancer cells in them. My lymph nodes were fine, and I was given the all clear by the wonderful Mr. Basu. in July last year. He advocated a period of radiotherapy to ensure that anything unwanted would hopefully be completely eradicated. So finally, I attended 5 weeks of radiotherapy, 25 sessions in all. The entire treatment took up 9 months of my life, and people frequently ask me what cancer treatment is like. I have to say, chemotherapy is vile. There's no dressing it up. It is absolutely ghastly. However, it worked for me, and so chemotherapy for me is literally a lifesaver. A question I'm often asked is, would you have chemotherapy again? Honestly, I cannot say. I know that triple-negative breast cancer is a particularly aggressive cancer. It is possible it may rear its head again. Cancer is tenacious. However, there is little point in dwelling on what-ifs and making myself miserable. I'm a bit of a Buddhist, and the spiritual path I have chosen has taught me to live every day in the moment, because it's the only one we have. So that is what I try to do, and that helps me. If the cancer returns, I might just continue to eat a healthy diet and take cannabis oil, which is becoming increasingly recognised as a helpful alternative therapy, particularly in breast cancer. But I don't know what I would do, and I choose not to think about it too deeply. My surgery went very well, although an unexpected reaction sent my blood pressure plummeting, but I wasn't aware of the ensuing drama. I saw no golden orbs. I heard no one calling me into the light. When I awoke and later stole a look at my new breasts, I was absolutely wowed by them. I still am. They are lovely, they are here, and best of all, the cancer has vacated the premises. Friends and family affectionately refer to me as Perky Pit, which always makes me laugh. So the surgery has had an incredibly positive and beneficial effect after such a horrendous time with chemotherapy, and it has left me brimming with a newfound confidence which lingers. It's great, and I have Mr. Basu and the splendid team around him to thank for such a happy outcome. In comparison to the chemotherapy, radiotherapy was a walk in the park. I became quite tired, but I think that was more because of my journeying to the QE hospital almost every day for 5 weeks, as much as anything. My skin is still reddened by the radiotherapy. I don't mind. I was made aware of the risks involved in radiotherapy, but I believe the benefit outweighs the risk. Everybody has to make their own decisions with cancer treatment. It's incredibly personal. I still have some lingering effects from the treatment. Mr. Basu calls it the gift that goes on giving. I have a little bit of chemo brain. It hangs about and I still word search, or the words don't come out in the correct order. I have neuropathy in my toes. I lost my toenails during treatment and they've grown back incredibly hard. My hair grew back an entirely different colour. It has gone steel grey and white and is now very curly. Previously it wasn't, so I prefer to keep it short. I have bone ache. With the passing of time, though, each day gets a bit better and a bit more better. And a year after my treatment concluded, I feel I am at last beginning to get back to me. When I lost my hair, my friends asked me to do impersonations of famous bald people. I began by making a spoof video of Sigourney Weaver's character Ripley in Alien. "Stay away from her, you bitch," followed by Sinead O'Connor singing "Nothing Compares to Chemo." My Daddy Warbucks was pretty good, as was Walter White from Breaking Bad, but by far and away my best impersonation was Marlon Brando's character Kurtz from Apocalypse Now. I did not accept the Oscar. Maintaining a sense of humour to combat the fear, to chase away the dread, was and is absolutely essential to me. So there you have it, a brief her story of time. I was recently counselled in the genetics department at the QE. I was seen by Dr. Kay Ong, a lovely woman, and she sent me a lengthy and incredibly helpful letter afterwards explaining that I do not have the BRCA gene. That is a relief to me, as I have children and grandchildren, yet it is also fascinating that breast cancer has appeared in 3 generations of my maternal family. We were all around the same age when the cancer appeared. It appeared in the same breast. Because my breast cancer is triple negative, Dr. Ong is unable to tell me what triggered it. It may be, well, it probably is, something that researchers have yet to find. Another genetic link perhaps, or a particular lifestyle, or a combination of as yet unknown factors that placed me at increased risk of breast cancer. And my age, of course, I know that. Breast cancer has massively impacted on my life. When I was diagnosed, I lost my job. It's hard to believe, but I'm not the only one to receive very poor treatment by employers who do not wish to embark on a journey of support. I lost my status in my local community and with it my confidence. It takes a lot of strength, fortitude and wisdom to get that back again. Negative experiences, however, have played a very small part in my life as someone who has had breast cancer. Since my diagnosis, I have found myself almost entirely surrounded by love. I have been able to help and support others who are facing a similar situation. I have adopted a healthier lifestyle. I have been able to take myself off medication for high blood pressure, amongst many other positives in my life, so it isn't all bad. Before I finish, I would like to say how fortunate I was to have met with Naren Basu. Not only is he a terribly good breast cancer surgeon, he is also incredibly personable and genuinely interested in me. His empathy is sincere. After my surgery, he came to see me very early the following morning just to check if I was okay. The team of staff around him, from the nurses to the registrars, all have adopted this patient-friendly approach, and I cannot emphasise strongly enough that friendliness and sincerity from your nursing team and consultants make an enormous difference to how a cancer diagnosis and treatment impacts on the individual. Finally, I hope this has given you something to ponder. I shall be here for the rest of the day. If you want to ask me any questions, please do, anything at all. And if you would like a more in-depth perspective of my life whilst undergoing treatment, then I've put all my blogs together as a small book. There are flyers lying around today which tell you more about it. Please take one if you would like to. Thank you. There you go, Kathy. Tell me what you think.